Hi, it's Drrodrohrich from Rohrich Knows Podcast. Welcome back and helping you become a better you. So today let's talk about temples. And why do we talk about temples? Because it's one of the first early signs of aging. And often it's something that people notice but don't notice. And what I mean by that, patients come in and say, you know what, I'm looking tired, and they always point to their cheeks and lower face. But often, especially in females, is they have temporal hollowing and they have wasting in this area. And so why do you see that? Well, because one of the first muscles that will tend to atrophy or lose, especially in an aging female, is it's estrogen dependent. So it's a skeletal muscle. So you'll see hollowing in this area. So when you're doing fillers, the most important thing to do is actually to begin from upper to outer to lower and help to optimize the result. So I'm going to talk to you a bit about how to do temporal hollow correction safely. And there's really two ways of doing it. You can do the deep method, which I'll show you, or a superficial method. And I think the key is, with both of these, you want to do it so you can blend a filler and never ever want to overcorrect, because the worst thing you can do is take a hollow one and make it from concave to convex, and that makes you look weird or Cro-Magnon. It's not a good look. So you really, if you do it optimally and just soften it, it gives you a more youthful look. And especially in the Asian culture, a beautiful, smooth forehead connotates wisdom and youthfulness. So that's a very important thing to do. So you can do it superficially if you want to really have a blending of the superficial part of the hollow, or you can do it in the deep layer. And the deep layer is where you go one up from the lateral eyebrow and one over, and you go right down to bone, the temporal bone, and you blend a filler in this area, and that beautifully fills in that hollow. And I'm going to show you that in this video, where this beautiful young woman had some temporal hollowing, and you can see the incredible hollowing she has. Her cheeks are very good, but she has hollowing in those areas. And the goal here is to fill and reshape, and to do it very, very modestly, and never to overcorrect it. And the hyaluronic acid filler we're using here is one called Voluma. It's a little longer lasting filler. And you can see we're going one up from the lateral eyebrow, from the temporal fusion line, and over and injecting deep in that area. And the goal here is to mildly correct it up to 50 to 70%. Never overcorrect this area. It's a very safe area, and you're injecting it in that area. And basically, you're going to soften the upper half of this temple area, and it really is a powerful response. And you can see that, and you can shape it. And then, of course, you do the same thing on the contralateral side. So you can already see how that's already softened and shaped her face. And of course, we'll then do it on the other side. And so this is a very powerful procedure when you do that, and it actually gives her youthfulness to her cheeks and her malar area. So again, going one up and one over, and you can shape and contour that beautifully in that area. And that's exactly what we're doing here. And you can really, really get almost instantaneous shaping and contouring and improvement in that area. And that's exactly what you want to do. And when you do that, and you hold pressure for a minute or so in that area, and it gives you almost instantaneous results in shaping and contouring. You can see, look how rejuvenated her cheeks are, even though you never injected in that area, because you fill that temporal hollowing. And that's really the beauty of the temporal hollow, which I call the secret area for correction of aging. And it's really a very, very finesse way to get not only a smoother forehead, but also one that looks very natural and youthful. So in areas like this, and these are just some examples of patients that had not only temporal fillers, but also had modest amount of fillers in their cheeks and their lips. And you can see the temporal filling in that area has been soft yet natural, where you're just correcting that hollowing in that area, and you're really getting that. And you can see that also in this patient that had, obviously, she had a facelift, and in this case, she had her temporal filler was fat, her own fat that really filled that area out and softened it, and you can see it here as well. And this is long-lasting. Another one that had eyelid surgery and a facelift, but she had temporal filling in that area, and you can see the temporal filling that it gives her a more youthful eyelid just by adding filler in that area. And it also makes her eyelid look like it's higher. So these are really some finesse aspects to correction of aging face, because the eye only sees what the mind knows, and if you can see that hollowing on the left and you can see how it's corrected, it has really done a lot to rejuvenate not only her eye, but her eyebrow and her forehead. And that's really beautiful. So the key and take-home message with temporal fillers is that less is more, and subtlety really, really stands out, because when you see the aging face, you should always start from above and go below, and you go from outer to inner. And the temporal filling in these areas, as you've seen in these patients of various aging, has really demonstrated the finesse in the use of both fillers and fat in giving you a more youthful look. So give any comments. Tell me what you thought about temporal hollowing and temporal filling. And if you're a candidate, make sure you go see a board-certified plastic surgeon or a dermatologist who is really, really well versed in exactly what you need and can do this safely and correctly. So know before you go, find an injector that truly understands facial aging and does it safely. So thanks again in helping you become a better you.